Hello, I am Otter and welcome to my presentation about the HIV and AIDS special population in the United States. In this short presentation, I will cover some basic background information about the HIV/AIDS patients, their demographics, characteristics of risk, a brief look at the health outcomes, and finally end with recommendations moving forward with improving current health outcomes of this population group. To start, there are around half a dozen immunocompromised subpopulations in the United States, including the elderly, malnourished, cancer patients, and transplant patients. Since it would take more research to cover every subpopulation, I have shifted focus to only the HIV and AIDS subpopulation. In 2013, it was reported that 1.2 million people were living with HIV and AIDS. 1 in 8 people were unaware that they had HIV. Although the size of this epidemic is not widespread in the country, there are a few key subpopulations where the prevalence of HIV and AIDS is notable. The Black and African American subpopulation in the United States account for the largest proportion of new cases of HIV and AIDS. It also turns out that Black and African Americans are the smallest proportion of the total population of the United States, making up only 13.3%, while whites make up 77.1% of the population. Hispanics and Latinos are also a minority, falling between whites and blacks with 17.6% of the population. Further dividing the black subpopulation, we see the highest prevalence of HIV occurs among black men who are MSM, or have sex with other men, while the lowest prevalence is among white heterosexual males. We can also see the distribution of the diagnoses of HIV according to region, with the Midwest and the South having the highest proportion and rates of HIV. In addition, the South also experiences the highest risk of being diagnosed with HIV and AIDS. As we have seen, some of the predisposing characteristics that put an individual at higher risk for HIV and AIDS include being a black homosexual male and being in the southern part of the United States. In addition, living in the rural areas also have a negative impact on access to healthcare. According to a recent report, close to 60% of the primary care shortage areas were located in the rural areas or non-metro areas. With this reduced availability of the primary care physician, patients who need to get proper information and tools necessary to be safe from HIV infection are unable to do so, which results in increased rates of new HIV infections. Furthermore, there is less income in the rural areas. Apart from the increased risk of homelessness, less income puts these areas at higher risk for HIV due to less ability to purchase preventative measures. If we look at the household income of the United States, we can see a clear band of households making less than $40,000 a year towards the south of the country. To add, blacks and African Americans have been reported to have the least amount of household income as compared to other ethnic groups. Having this economic disadvantage not only costs individuals physically, but the emotional toll of not having access to care negatively affects the person's health, leading to other complications. Even though we have seen that ethnic minorities are worse off in the United States, there is legislation in place that provides affordable health care to these underserved groups. With the ACA passed under Obama, persons with pre-existing conditions such as HIV will not be denied coverage. In addition, the coverage that the ACA provides is more affordable, with tax credits that lower the cost of premiums and out-of-pocket costs for low-income families. Furthermore, the ACA provides coverage for screening tests for HIV and other chronic diseases. These combined efforts mandated in the ACA helps to provide access to quality healthcare for those that need it the most but are also disadvantaged the most. With the current administration in the White House, how do you think the underserved populations will be affected? Do cuts to the ACA necessarily mean bad fortune for the underserved? Or will local government implement their own programs to serve the underserved?